Thanks, everybody, for joining us today. I'm very pleased to be joining you on the traditional territory of the T'an Council and the Kwantlen Dun First Nation. I want to update Yukoners on our government's collaborative efforts with the Government of Canada to respond to COVID-19 pandemic. In July, I was very pleased to join the Canadian First Ministers in announcing the Safe Restart Agreement, which set out shared objectives and committed federal resources in areas that are critical to the safe resuming of the economic activities across the country and reducing the ongoing impacts of COVID-19. Now, through the Safe Restart Agreement, Yukon is receiving $13.5 million in direct federal transfers to support the readiness of our territory's health system in the upcoming months. This agreement also included a commitment from the Government of Canada to provide additional support specifically for the territories through a separate agreement to address the shortfalls of the per capita allotments. Additional northern-specific funding supports will go to addressing the higher costs of delivering equitable services in the territories. I greatly appreciate the recognition both from the federal and provincial leaders of the unique circumstances of the territories and their support to advance considerations that are specific to the North. Today, I am pleased to announce that as part of the Northern Support Package, Yukon will be receiving an additional $12.4 million, $7.7 million for healthcare, and $4.7 million to support vulnerable populations. This brings Yukon's total allotment under the Safe Restart Agreement to approximately $26 million. Now, the additional funds for healthcare will support our territory's 3 hospitals and rural health services, will help the Chief Medical Officer of Health and the Yukon Communicable Disease Control Center to maintain enhanced services related to the pandemic, and address emerging and growing needs in mental health and substance abuse treatments, including support for frontline service delivery. Additional funding for vulnerable populations will help to address the needs at the Whitehorse Emergency Shelter and community shelters and promote infection control in long-term care settings. Last week, I tabled a supplementary budget in the Legislative Assembly that outlines additional spending largely focused on responding to COVID-19. This Northern Support Package provides another $12.4 million to offset the costs associated with the pandemic, in addition to the $52.1 million in recoveries identified already in that budget bill. Our government remains focused on protecting Yukoners and supporting them through these extremely challenging times. We will continue to work collaboratively with our partners across the country to respond to this pandemic. I also know that Dr. Hanley and his team are working in collaboration with the medical officers across the country, including officials at Health Canada, to ensure that we remain well prepared to manage the public health risks that are associated with COVID-19. Working together and taking a coordinated approach to managing to COVID-19 is still extremely important. We are seeing case counts rise in other provinces, and there's no denying that the second wave is happening in Canada. The best thing that we can do to protect against the spread of COVID-19 is to continue taking the precautions that Dr. Hanley has recommended in the last several months. Practicing the Safe 6 remains incredibly important. Washing your hands often, maintaining physical distancing, staying at home if you're feeling sick, traveling responsibly and respectfully, self-isolating as required, and also following the guidelines, the gathering guidelines, including limiting indoor social gatherings to 10 people if they're not in your bubble. This is extremely important as we look towards Thanksgiving this weekend. This time of year is usually an important opportunity for family and friends to gather and to break bread. I know that everyone is eager to spend time with their families and their relatives and their friends. Indoor social gatherings present a higher risk. That is why it is important to keep your gatherings small, to practice physical distancing, and keep your hands clean and cough and sneeze into your elbow. We all need to remember that the actions that we take are not just to protect ourselves, but they are to protect everyone in our community. We all have a role to play in keeping our communities safe and healthy, and we need to remain vigilant. Thanksgiving is also a time to express gratitude. Our territory is filled with dedicated individuals, businesses, and organizations that have risen to the challenge that we are facing over the course of this pandemic. The kindness, the compassion, and the care that we have seen across this territory continues to inspire me. It is a constant reminder of why this is such a great place to live. I want to say a big thank you out there to all Yuconners for their collaborative and collective efforts to keep our territory safe and strong. We've been in the grip of the pandemic for over a half a year now, and I know that it has affected the mental wellness of Yuconners. The measures introduced to protect the health and safety of Yuconners have made it hard to connect with our families and with our friends, and we understand that. This has been an extremely challenging place and time as we navigate the uncertainties of the pandemic, in addition to the normal challenges of life that we always have to grapple with if we weren't even in a pandemic. It can be hard to reach out for help, even though we know deep down we need it. I encourage all Yuconners to be kind and compassionate and to talk with one another. It's extremely important. You need to check in on each other and to support one another. This is National Mental Illness Awareness Week. It's a reminder for all of us to engage in earnest conversation about our emotional well-being with our family, with our friends, and with our colleagues. Having someone to talk to makes all the difference in the world. It can help improve or maintain our mental health in uncertain times. I want to remind Yuconners that mental wellness services are available through the Canadian Mental Health Association, Yukon Division, also All Genders Yukon Society, and the Mental Wellness and Substance Use Hubs in Yukon communities. There are also workshops and programs available to Yuconners that promote mental wellness and mental health. You can find all this information and all the supports on mental wellness services on yukon.ca, as well as the Health and Social Services Facebook page. Last but not least, folks, again, we are all in this together, and together we will get through this. Thank you very much for your attention. I'll pass it off now to Dr. Hanley.
Thank you, thank you, Premier. And I can't agree more with that call to be aware of our mental health, to support each other in our mental health through these difficult times, and to reach out for the many supports out there when you need it. Apart from the attention around the American president testing positive for COVID-19, there have been what I've seen two major COVID-related themes over the past week or so. In North America, the continuing resurgence of COVID activity in many of the provinces, particularly Ontario and Quebec, and new technologies coming into play to augment our response to the pandemic. I will review a few of these technologies and coming additions to our armamentarium. As I go through them, you'll note that each of these technologies or devices comes with advantages and limitations. One of these technologies, which is rapidly being adopted in many places in Canada, is the Covert Alert App. I wanted to take this time to explain a little in depth about this app and about what role this app may play in Yukon. This is one technology that, in my mind, a wait-and-see approach is preferable. As we learn more about the app, its advantages and its limitations, it's also important that we learn about what value it adds to well-established practices in public health. With our ongoing low COVID activity, we don't need to be in a rush to decide. So how does the app work, and should people download it? The Covert Alert App is a remarkably clever invention, developed by Apple and Google, and which takes advantage of Bluetooth-equipped devices talking to each other when in close range. Once you download the app, it tracks locations through your phone. If your phone has been in the same location as an individual's phone, and that individual is later diagnosed with COVID-19, and that individual uploads the information using a code provided through public health so that there's no risk of divulging personal information. If that individual uploads the information, then you will be anonymously advised that you may have been exposed. The app therefore depends on the individual who tests positive to cooperate by uploading the information. The app, of course, also depends on the assumption that you are with your phone. A pretty safe assumption for many of us, but not necessarily always the case if phones are either shared or left in the car. One of the limitations about this app is that it does not weed out the high-risk contacts from the low-risk contacts. All contacts are equal, which we know is not the way COVID-19 works. Now, let's say you're shopping in the same store as someone who receives later a positive diagnosis, and you were only there a few minutes with transient contact with that individual, perhaps brushing past that person in the produce area. That is not generally the type of contact that we worry about, as compared to, say, sharing a table at the bar and having a long conversation for an hour. Traditional contact tracing, as carried out in Yukon, ferrets out information elicited through careful and often repeated questioning, as well as additional techniques such as interviewing family members, checking receipts or phone calls, determining where the case has been and who that person has been in touch with and what type of interaction took place. The phone app has no way of distinguishing the higher risk contacts from the more casual transient ones that we don't really worry about. So we would be potentially identifying many low-risk contacts per case identified through this method, and potentially asking a lot of people to self-monitor or test or self-isolate without detailed exposure information. In addition, we may be adding to the demand on our testing and on our public health workforce. Everyone in contact will receive a ping, and much time and effort could be used in testing or tracking contacts who are not really contacts. Yukon Communicable Disease Control and Community Nursing are experienced in contact tracing, and to date have managed all of the work with their usual aplomb, including some very complex tracings. Are there advantages to this app? There are likely to be advantages, especially where contact tracing may already be stretched or overwhelmed, or when COVID activity is high. The utility of this app is less certain in our smaller jurisdictions with limited activity. That is why we would like to take some time to learn from other places where the app has recently been introduced. I have downloaded it to help understand it, and I know many people have downloaded when they have traveled outside of Yukon. And there's nothing to stop you downloading it either. It's an innovative app, and especially if you're traveling outside Yukon, it might just come in handy. If a returning Yukonner were to get pinged that they have been possibly exposed while out of the territory, we would ask them to contact YCDC, or Yukon Communicable Disease Control, for follow-up. As we continue to move through the months following COVID's arrival in Canada, there are more and more tools presenting themselves to us, and like always, we take a careful and measured look at what is out there before signing on. One new tool that we hope to begin using in the weeks to come is the Swish and Spit, or the Gargle Test, that was developed in BC. This is another way to test for COVID-19 that does not require the swab in the nose. Designed primarily for use by children, the Gargle Test is the same test, but a different way of obtaining a sample. We will shortly begin to pilot this method through YCDC, and following that, we hope to introduce it to our other testing sites in Yukon. I'll keep you updated as we go through the initial steps of validating this test for our population. We're grateful, as always, to our BC lab partners who have led the way with this new way of collecting samples from children. BC CDC Lab continues to provide the vast majority of our tests, and we continue to profit from their expertise, high test quality, and the rapid turnaround time that we need. Another new tool we plan to add to our toolbox once available is the Abbott Id Now, a portable, rapid molecular test that can provide test results within 15 minutes. This test was approved by Health Canada only days ago, and we anticipate receiving our allotment of 10 machines. These tests will definitely add to our testing capacity and will again be of use for those times when we really need that rapid result, such as when tackling an outbreak. Since the Abbott Id Now is portable, rapid, and easy to use, this machine will be a particular asset for rural and remote areas of Yukon as well. The test is highly accurate, however less accurate than the PCR molecular test currently that we use based in BC, which is why that will remain our standard test for everyday use. As our partners around the country learn more about this new technology, we will learn more specifics about the test specifications, its advantages, indications, and limitations. As we get closer to acquisition of these machines, likely towards the end of this year or the beginning of next, we will, in collaboration with BC Labs, develop guidance for how these machines will be used and where. These machines are only licensed for symptomatic testing, so cannot be used, according to agreements with the federal government, for asymptomatic testing. In territory, we already have the Gen Expert machine, which is the first molecular test apparatus we have had in Yukon. The machine is at the Whitehorse General Hospital lab and must be run by trained and qualified technicians. This test is highly accurate and offers a rapid turnaround time as well. However, we do reserve this test for those few cases when we really need to know right away the result, as there are globally limited supplies of the testing cartridges required. We just heard yesterday about the antigen testing technology, also an Abbott device, the PanBio, that was approved by Health Canada, and once again we expect the ability to acquire these machines when available. Again, these are portable, quick, and simple to use. They also have limitations with accuracy. As they test for viral antigen and not the virus genetic material, they could miss an active infection. What exact role they may play in testing, when they will be useful, when not, will also be something we will study and learn in the months to come. As we look forward over the next year, we want to ensure that our testing capacity is prepared to meet any demand that could hit us. Right now, we continue to be confident in our preparations, both with testing and with contact tracing. As cases surge in other parts of Canada, and as we move through phase 3 of our own pandemic, we can continue to modify, I've lost my page here, we continue to modify our approach as we learn more about COVID and acquire more capacity to manage. Initially, a few months ago, there was so much that we had to shut down or curtail. Bars and restaurants, gatherings, personal health services, workplaces, healthcare, and many other settings. When the first cases were diagnosed in Canada, and when our first case was diagnosed in Yukon, we restricted ourselves to protect ourselves and our families. Although we never had to shut down to the extent that many others did in the country, we were still barely moving from our home environments. The streets were almost empty. We didn't yet know about what we were dealing with. As our initial case activity settled and the pandemic continued its march around the world, we learned more and more about the disease, and we became much better at taking steps to protect ourselves. We were therefore able to start opening up our lives again. We could see people outside our household. We could return to work and eventually school. We enjoyed the Yukon summer and a wonderful fall. Thanksgiving is just ahead, followed by Halloween, and then winter, and new phases of managing our lives during COVID. I think we're all now into something of a groove in living with COVID, even though I still hear from those who still think we need to shut down everything to ensure our protection. Those voices are quieter, and perhaps there is growing realization that being shut down is not the way to keep ourselves healthy and sane. But we also know that we may need to do things differently than we did in the summer. Those large outdoor gatherings will need more layers of clothing and larger bonfires, or we'll need to break them up in order to move indoors. Indoor gatherings with closed windows and doors are an invitation for COVID to spread. I heard through the grapevine a good illustration of how COVID can be spread indoors. Imagine a group of 10 people doing crafts at a table. One uses glitter, but you know how that stuff gets around. All 10 end up going home with glitter on their socks. That's how disease spreads if we don't take precautions and good care. I don't want you to give up the glitter, but I do want you to remember that visible example of what in reality is COVID's invisible spread. The White House cases, especially those associated with the newly nominated judge's celebration, illustrated once more how COVID can spread to many people at once. People who are gathering close, not observing distancing, not even wearing masks when they're infringing on each other's bubbles. COVID is largely pretty boring in how it spreads. Droplets and close contact, hand to mouth to mouth, spit to spit. But in the right circumstances, aerosols are also formed that can spread further and infect many people at once. COVID is an opportunist, and we have to prevent those opportunities for rapid spread that could overwhelm us or lead to community spread. That's why, by avoiding large gatherings, by limiting indoor gatherings, by observing the Safe 6 measures, we keep those opportunities for spread, should COVID appear, to just the boring type, one person or two, or a small cluster that we can handle. If there was ever a time I found words from a certain US leader that I agreed with, it was when he said, "You don't need to fear this disease." He's right. We shouldn't live in fear of COVID. Fear leads to irrational reactions driven by panic, being too avoidant, withdrawn, or hostile to others. But equally irrational is ignoring the threat that the virus poses. Let's not kid ourselves as to how devastating a disease it has shown itself to be. We do need a healthy respect for this virus that has reached many millions and killed over 1 million in the world. Not fear, but knowledge and familiarity with what it can do, doing the right thing, and listening to our best advice as we learn more about COVID and transmission. Not fear, but continued action to meet the threat by observing the preventative measures that have been shown to work and that have undoubtedly worked here. We're learning to live with this disease and eventually, with the help of vaccines and treatments, incorporate this added threat into our everyday lives. Always in our path forward strategy, I try to maintain that theme of living with COVID risk, living in the best way we can, with managing the risk of COVID alongside the risk of being too restricted in how we carry out our lives or make a living. We will continue to strive for that balance in being able to thrive as best we can while keeping COVID's threat to a dull roar. We have much to be thankful for as we approach Thanksgiving weekend. We would do well to remember those who are having a hard time at the moment, whether in areas around the world that are hard hit, or here for those who have lost jobs or businesses or who face a bleaker winter ahead. But overall, we're doing okay, and we are going to get through this. Let's celebrate Thanksgiving thoughtfully, cautiously, but with kindness and gratitude for all the freedom we have. Remember, as you gather with families and close friends, be thankful for our beautiful fall weather that continues. Stay outside for gatherings as much as possible. You can gather with up to 50 people outside if you maintain physical distancing. Avoid hosting or attending any gathering if you're feeling unwell, even if your symptoms are mild. Though your social bubble can include up to 15 people, indoor gatherings are limited to 10 people. If you're eating together, have a designated carver and server to limit sharing of germs. Avoid sharing glasses or cutlery, snack bowls, or pepper shakers. And set your table and chairs for physical distancing between people from different bubbles. And whether this Thanksgiving weekend or after that, always follow the Safe 6. Be mindful of those 3 C's where COVID can catch us out: closed spaces, crowds, and close contact. Be kind, show gratitude to each other. And like the Premier says, check in with each other. That's all for today. Thank you. Merci.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll now go to the reporters on the line. One question and one follow-up, starting with John, CKRW.
Hello. I was wondering if the Premier could maybe dive into some of the mental health and substance abuse supports that he mentioned when announcing the additional funding earlier.
So early days on the funding announcement, obviously, but as we negotiated the safe restart, this was a conversation that was happening right across the nation. The mental health of every individual right across Canada has been drastically affected by COVID, and so it wasn't just necessarily specific to Yukon. This is something that all jurisdictions said is extremely important. We're extremely lucky to have the mental wellness hubs that we do have. We're extremely lucky to have the rural and urban supports that we do have with the non-government organizations, but also with the Department of Health and Social Services as well. What this is going to do is augment. What this is going to do is allow us to, as we have been doing all summer long for the last 7 months, understanding where we are in time and place and making sure that the programs and services that we have support the need today. It is very hard always to predict what's going to happen in a couple of months from now, and so we have to make sure that the programs that we have fill the need for today. So whether this money goes directly to support the amazing people that are the 22 people in the rural communities that are on the front lines and have an extremely important role to provide and making sure that their mental wellness is kept in check as well, or whether it's to provide other supports or services in other or helps with the NGO community, we'll be making those announcements as we go. I know that the Minister responsible for Health and Social Services, Pauline Frost, has been very active in a whole-of-government approach when it comes to mental wellness in all departments. And the good news is, we have been bolstering that mental health support over the last 4 years. This money on top is just going to be just the extra support that we need to make sure that all Yukoners are being met where they are, and hopefully hoping them to maintain what they need to live a healthy life today and into tomorrow.
Thank you, John. Do you have a follow-up?
Yeah, I was hoping Dr. Brennan Hanley could talk a little bit more about the new swish and spit or gargle test, and maybe discuss, I guess, what the review is looking like right now for that, and when people might be able to actually access that test for children.
Yeah, it's hard to be very specific on the timelines, but I will keep you apprised. So it's really only newly established in BC. We as you know, we work very closely with our colleagues at the BC lab, and so we're getting the gear, as it were, and the information that goes along with it. And we just want to make sure that that we have the guidance set out appropriately, and that then our providers get trained on how to administer the test. So in turn, the children and their parents can be instructed in how the kids are supposed to do this. There are very specific instructions for this in terms of the swishing around the mouth and the holding in your mouth. Really what you're trying to do is replace a swab in the nose with an adequate sample collection just through swishing and gargling. So you really want to get the secretions out of the throat. So you'll see on the BC website that they have a kind of a one-pager on how to do this test. So of course we'll be adopting those same instructions. And then of course it requires just a specific way to collect the spit. Of course it has to be done in a way that maintains our infection control practices. So it's really all kind of getting the protocols in place and then rehearsing them before we bring it out. So I mean, it's a matter of weeks. It's not long, but I will definitely keep everyone apprised.
Thank you, John. Moving on to Terry, Canadian Press.
Sorry, I had on mute and then I'm on speaker, so I'm doing everything wrong. You see that BC is increasing its numbers. There's more than 100 every day. Quebec, Ontario. I'm wondering if there's any thought. I mean, Yukon has been largely unscathed except for all the shutdowns. I wonder if there's any thought that you might limit travel from other provinces and territories.
So we've been working hand in glove with Dr. Hanley and his team as he works with the national organizations right across the Canada for mental for health, and of course being plugged in with other jurisdictions as well. And the plans that we've been putting forward have been working so far. Our path forward has triggers for forward and for backwards. As we monitor the epidemiology in other areas, we're very conscientious that any step forward we don't do unless we know that we have a huge amount of confidence in those steps. And so far, so good, as you mentioned. 15 cases so far. We haven't seen community spread, and we have seen a large quantum of people traveling through the Yukon. We've had over 50,000 people traveling through Yukon. Of those, the BC residents are just over 11,000, and the balance between mental health and the balance between that and the drastic effects of COVID, we've been striking a great balance between those two. I wouldn't say bug, but I talk to Dr. Hanley on a almost daily basis about the epidemiology, the traceability of British Columbia versus other jurisdictions, and we're still very confident and comfortable with our ability to know, the way that it's spreading in BC, the province that we are open to right now, and mitigating and calculating the risks that is associated with that. With that being said, though, as well, Terry, we are in a pause in our final plan, in our final phase of the plan before a vaccine. So we're, even though we're not moving backwards, which is great, we're still not necessarily moving too far forward either at this point. We're cautiously optimistic with Alberta right now. We're cautiously optimistic that Canadians will help us right across this nation from coast to coast to coast to combat this virus by doing what we need to do. And we've heard Dr. Tam, we've heard Dr. Hanley, we've heard everybody say the exact same thing. Like the way that we can work together to make sure that we do move forward through these plans, that's up to Canadians right now. It's up to everybody to understand their responsibility in this battle. But at this point, we think that we're in a good place right now with our existing bubble. Cautiously optimistic that we'll be able to even move more forward, soon. But at the same time, nothing else to report on that right now.
Thank you, Terry. Do you have another question?
Yeah, I do, actually. So I know that I see that a large percentage of this money is going towards mental health support. Has there been an increase in mental health problems in Yukon?
Again, as we negotiated the envelopes, as we were calling it, through the Safe Restart, those envelopes were created based upon need right across Canada, and whether it be needs for hospitals in rural versus urban settings, that's a conversation right across Nova Scotia, right through to Nunavut and up to the Yukon and British Columbia. Making sure that our communicable disease centers, those types of things are adequately funded, and basically just keeping constant awareness of the mental wellness, not necessarily just a Yukon-specific consideration. What we have now here with the Northern Support Package is a consideration of all of these envelopes that were developed during a conversation with the nation. They were per capita funding, and if you're a place like Quebec, that's great, because you're going to maximize the dollars in that. It doesn't help the smaller jurisdictions, whether you're Premier King in Prince Edward Island, or Premier Sigavik in Nunavut, or ourselves here in Yukon, or even some of the bigger provinces the other medium-sized provinces. Base Plus was part of the dialogue, and when you look specifically at the Northern Support Package, Base Plus is what we got. So envelopes were created based upon themes. The unique circumstance of the North predominantly is it's more expensive to deal with these issues that are happening right across the country in the Northern context. And I want to give a shout out to the federal government and the provinces. I've said this before on this table. Who would have thunk that Doug Ford would have been such a positive supporter to the territories? But he really was. Somebody who's the premier of a larger jurisdiction saying, look, we can't forget that the territories are not provinces, that the territories are very northern. They're different styles of government. They have different considerations, and to have that support in the communique through the Council of the Federation into the finance, into the First Minister's meetings, conversations, it's extremely important that recognition happened, and that has resulted in these envelopes that were established, having a top-up, if you will, that gives us the plus to a base plus consideration from federal supports.
Thank you, Terry. Moving on to Chuck with the Whitehorse Star.
Yes, good morning. This is for Dr. Hanley, and I think it was probably already answered by Premier Civil, but I'm going to ask it again. Anyways, Dr. Hanley, none of it is recently reported 9 new cases in a remote mine in Hope Bay. Does that give you any cause for concern in maybe looking at, further restrictions on travel from Nunavut?
No, not at all. In fact, the cases in Hope Bay and Nunavut were isolated to that site, and associated most likely with an importation that, as I understand, has not yet been clearly identified. But nevertheless, this is in a remote site, and it does not link to any risk for exposure to others in Nunavut. So really, that changes nothing about any concern about exposure to Nunavut. I continue to work very closely with my counterparts in the other, actually across the North, but particularly the Northern Territories, and we discuss many of the issues in common, including how we put in protections or support recommendations and advice to reinforce protections for our remote work sites, such as the mines, but also many other issues that we have in common. Just like the Premier said, as territories, we're a little different. We all have small populations that are widely dispersed and remote, so we really have a lot of issues in common. But no, this particular case would not change my degree of comfort that we have with our bubble, with our northern territories, nor with the advice that I would be providing to the Premier.
Thanks, Chuck. Do you have a follow-up?
No, thank you very much, Dr. Hanley. That's good for me.
Okay, we'll go to Haley with Yukon News.
Thanks. I have a question. I think it would be for the Premier. The $12.4 million for $7.7 for healthcare, and some of that being spent on hospitals. I wonder if you could expand on what kind of upgrades hospitals need, if there's any kind of long-term increase on ventilator capacity, or if it'll be sort of daily things like PPE.
More of those details will come for sure, Haley. As far as ventilators, we're good. We definitely have the capacity now. But again, to kind of riff a bit on Dr. Hanley as well, the interesting thing about the Northern Support Package is, as much as we are territories and very similar in that capacity, we're going to be spending our support packages probably a little bit different amongst those 3 territories as well. We don't have as many remote, non-highwayed communities, so the needs in the territories are going to be a little bit different. When we take a look at what we need, I think it's again more money and more support for the things that we've already identified. Just the capacity to make sure that we're ahead of this, our capacity to trace, are making sure that we do have the PPEs that are available, but be able to split that $12.4 million into, extended needs for the healthcare, because as we've seen, based upon the tabling of our budget, we've already spent an awful lot of money on keeping people safe. And so, you take a look at the almost $100 million that we spent in the supplementary budget that has been followed by recoveries from the federal government of over $50 million, and now this just adds to that as well. A lot of it's been identified already as need. A lot of it's been identified as extra spending that we've already done when it comes to our medical community, and so it won't be any surprise to anybody that what we've already identified as needs and pressures, we now have extra capacity and extra dollars to deal with that. That is also to say that as we move forward, who's to say what happens in the next, as we get into the second wave across Canada. We need to make sure that we're just as diligent. We need to make sure that we continue to communicate with our partner governments of the municipalities and the First Nations governments, and there will be a need for spending in capacity building therein as well within the rural communities. So again, whether it's substance abuse treatment or frontline service delivery, the need has been clearly identified so far as to what we have to spend money for. We're spending into a deficit already as a territorial government. So this money over on top, which again, as we, a lot of this conversation started for the safe restarts back in the beginning of August. So we've been identifying those needs through the month of August, into the month of September, and into October, and clearly identified, but at the same time, a very welcome support for the unique circumstances of the North.
Thanks, Haley. Thanks, Haley. Do you have another question?
Thank you.
Okay, Philippe, CBC Yukon.
Yes, thank you. I wonder if the Safe Restart program could mean additional funding or changes in long-term care homes. They haven't been mentioned yet.
Well, I'll start, and I'm sure Dr. Hanley has a comment on this as well, but I'll start by saying, our long-term care in Yukon is different than what we're seeing right across the nation, especially with some of the very concerning issues that are happening right now in Ontario and different places. 4 people per room is still occurring in different jurisdictions, and we don't have that issue here in Yukon. We don't have hybrids as well. These are government-run facilities. So again, the care of our elder support is extremely important. What's really important as well is is making sure that we do all we can to protect the frontline staff and professionals that are there caring for our elders in these communities. But we're so far so good. When you take a look at the national conversation about concern about our continuing care facilities, we're blessed in the Yukon comparatively to other jurisdictions that are going through some very traumatic times. That's not to say that we don't have an obligation or responsibility to make sure that this vulnerable part of our population is cared for, and I know that the departments that are responsible for the care of our elders are doing their utmost to make sure that our elders are safe, whether it's with the extended programming that we've done in the rural communities to make sure that we age in place, as much as possible, because elders in our communities are such an essential part of our rural communities and our urban communities as well, but also in the bigger facilities that we do have in Whitehorse, making sure that they're protected and feel safe is an extremely important part of elder care.
If just to add to the Premier's comments, I totally agree, and I think the Premier captured all the key points very well. Where of course, we're all concerned about long-term care and making sure the protections for one of the most vulnerable segments of our population, that all those protections are in place. But we are. I think this is an area where we can all be proud of our facilities as Yukoners, that they are publicly run and all under one government administration, under continuing care. So we have. We have single residents per room. We have uniform procedures and administration. centralized, so that we do have a tremendous number of advantages compared to some of the larger jurisdictions where you have that whole mix of privately owned facilities and less centralized administration. So, of course, many of those protections have been in place for some months now, in terms of strict infection control, the screening of visitors and staff at the door, staffing rearrangements to ensure that staff are focused in one facility and not crossing from one facility to another. In terms of the visitation policies, which we have tried to work with continuing care so that they are appropriately revised as they become, as we know all of the other protections are in place, and we know that the procedures are working, and the use of PPE where appropriate, including the use of masking by staff. So really, there's this whole package of protections are in place, and it's not to say that we're not continually rechecking, revising according to again emerging evidence and experience. But I do think our long-term care facilities are well protected.
Thanks, Philippe. Do you have another question?
Yes, thank you both for taking the time with your answers. I wonder if we will see any changes to the shelter under Safe Restart. There's going to be an expectation of more use as the temperature gets colder. Will there be any changes to the shelter in Whitehorse?
So, absolutely, there's funding. Part of this funding is for vulnerable populations, and so this is going to help with the minister and her team as she works collaboratively with not only people in healthcare but also in housing. The work that Minister Frost has done with the Departments of Housing and Department of Health and Social Services for the full gamut of care, whether it's affordable housing, social housing, or infection control in long-term facilities, including the Whitehorse emergency shelter. We've done a lot of work, and we have a long road to go still. And so, yes, we will apply some of this money, obviously, to the vulnerable populations. And if we do that, of course, that's going to be concentrated in the Whitehorse emergency shelter, but also in the community shelters as well. We can't just look to the WES as the only shelter. There's unique circumstances in the rural communities as well. But what we've seen over the last 3.5, 4 years under Minister Frost's leadership is a complete change in that shelter to begin with. So it's an ongoing process, and with the rooms that are available now upstairs there, and taking a lens for the first time as a government to how that looks in the greater concept of housing. I think that's been a really profound shift that the Department of Housing really needs to be honored for. I think they did a great job in it's not only just about providing a home or like a physical building, but the sense of home. It really helps somebody as they are struggling to try to live a better life and have a better life for themselves and have the supports to have that leg up. It's an extremely important part of this government's efforts to go more away from an acute care model to a collaborative care model, and these fundings will only help us to enhance those directions.
Thank you. Claudiane, Radio Canada.
Yes, hi. Just wondering about the Northern Pacific funding. Is this sort of an anticipation of the upcoming months? Is there a timeline? Is this just for the current fiscal year? If there were sudden need for more funding, is there room for more negotiations? Just wondering about sort of the other factors or aspects to this financing announcement.
Yeah, thanks, Claudiane. Absolutely, it's short term for sure. I mean, again, with all the packages and all the conversations we've had with the federal government, it's so hard to predict where we're going to be in 3 months from now. So the funding that we get is about where are we here and now and what supports do we need. Taking a look at programs that we already offer, and then take a look at if the nation is willing to accept provinces and territories a collaborative approach towards those funding envelopes and opportunities, or whether the federal government is working on their mandate. Lots of swirling questions about where we're going to find supports. Things like sick leave is a great example. We came out early with our sick leave program, and that conversation is continuing right across the nation, where we see a federal government that's developing a program based upon what we started here. But again, as we look at these remedies and these financial stimuluses, it's so hard to predict what's going to happen in 3 months. So we've kept our window to the immediate needs. And again, as I said in answering another question to a journalist, the restart conversations that very specific regional consideration to the federal conversation of funding supplies. And right away for me, it was looking at the businesses, the seasonal businesses coming to an end, and making sure that we speak with them to see how their limited season was this summer and how we can provide supports for them. But it's also, as we get into the more darker months, how we're doing as a society and what supports we need. So those conversations were made in earnest to develop the envelopes, as we're calling them, from the Safe Restart from August. But again, a very short-term window. We'll continue to work with the federal government and the other jurisdictions to identify, as we get into October, how are we doing now? What's falling through the cracks? Into November, how are we doing now? And we'll continue to press the federal government to make sure that their relief is flexible, unique not only to us. We've seen some supports come out that have been more successful than others, and the theme has always been, how flexible is that funding to the specific regions? I know that we're constantly in a conversation right now about rent supports. The federal program, pretty complicated when it comes to a buy-in from the landlords as well. So we have to keep keep pressing the federal government to make sure that the supports fit the need from specific communities, and we'll continue to do that as this money gets allocated, and then we start looking towards the darker, colder months.
Merci. Claudiane, avez-vous une autre question?
Oui, merci pour le docteur Hanley. J'entends dans vos propos peut-être une certaine inquiétude par rapport au long week-end qui vient pour l'Action de grâce. Êtes-vous inquiet du comportement des Yukonais?
So the question is for Dr. Hanley. We hear in your voice a bit of anxiety about the coming weekend and celebrations. Are you anxious about how Yukoners will celebrate during next weekend?
Merci Claudiane. C'est pas que je suis anxieuse ou anxieux. J'ai toujours le même conseil pour les Yukonais, et c'est pour rappeler, pour bien suivre les instructions, pour comment la comportation qui est attendue pour tous les rassemblements, et pour rappeler aux Yukonais que les rassemblements, surtout les rassemblements à l'intérieur, sont les endroits où on a vu tellement de temps dans le reste du pays qu'ils sont les endroits pour propager le COVID. Donc, jusqu'au maintenant, je pense pour la majorité des cas, la plupart des cas, on sait que les Yukonais sont très bien de suivre les conseils donnés. Mais je sais aussi que c'est fatigant. Et donc, c'est juste une opportunité pour rappeler les Uconn, mais j'ai beaucoup de confiance que ça va bien passer, comme toutes les autres occasions jusqu'au maintenant.
Do you want to repeat any of that in English?
Sure. The question really was I worried or anxious? And no, I'm not anxious, but I know that it's difficult sometimes to maintain our guard, and just I really wanted this Thanksgiving weekend. I really hope everyone has a great time, but with that degree of caution that we all require, and it's hard sometimes to remember all of those. The advice that we give, as well as the orders that are frankly in place, and that it's just a reminder that indoor gatherings are probably the single point of risk for spread of COVID, and we can't remind ourselves enough times that that's where we are or could get caught by that single introduction of a case into the right circumstances where you have people gathered indoors, especially with colder weather. The doors are closed, the windows are closed, ventilation may not be adequate, and those spacings between people can easily be breached, and those are the circumstances of risk that we all have to remember.
I'd like to thank everyone for their time today. Our next COVID-19 update will take place Wednesday, October 14th at 11 a.m.